What's the difference between somebody who has something like ADHD versus somebody who just needs to just do a better job at paying attention and staying focused on tasks and not getting distracted?
So, ADHD is one of those diagnoses in psychiatry that it's a double-edged sword because the people who really have it, it's a real problem, bigger than I think people appreciate. But yet, some of the symptoms are common enough that it's easy for people to think they have a disorder when they just have trouble focusing for the moment or even for this season of time that they're in because they're juggling too many things. Not every inability to focus or follow through on things is the disorder of ADHD. So what happens is everybody can get mixed into this one big pie, and then the people who do have a disorder get marginalized because of a sentiment of, well, everybody's got ADHD. So, what's the problem? All right, that's my my own personal frustration with dealing with this disorder because yeah, I will have some people come and want to get on put on medication because they've been doing well in sales all these years, but now the younger people are doing better, so they want to do better at 55, and so they want pills to help for performance enhancement. That is not the way to address that problem. But at any rate, I will say, and it's easy to get me going off on a tangent with ADHD because it's a very hard disorder to manage or deal with for the person who really struggles with more than just attention, but executive dysfunction. What does executive dysfunction look like? Poor planning, poor time management, even emotional dysregulation can be a part of ADHD. It's not part of the diagnostic criteria, but it's an associated symptom. ADHD can affect the way people think about themselves and their self esteem. Because if you think about it, some of these things with always like being late all the time, be exasperating for the people around them, and those people can then not want to deal with them, think that you're just lazy, think that you're not very smart, and it can really take a toll on your self esteem. As usual, I've lost track of your question because I have a lot of unvented feelings about this disorder because I've seen the pain of people who are struggling with it. And especially now with medication shortages out there, it's very frustrating. And these medications don't always, they can have their own negative effects. I was just talking with someone today about the crash effect of Adderall, taking it, being able to focus well for several hours, and then feeling this kind of crash and burn effect afterwards. And that makes them not want to take it.
So what I'm hearing you say is somebody who has ADHD, how you can tell the difference between that and somebody who just struggles to pay attention. It's more about how they operate and function in their daily life. Like, are they good at planning? Are they good at managing their emotions? Are they good at being on time to things and scheduling? And it's not just somebody who can't focus on a task for a period of time. Like, it's somebody who actually is challenged to manage their day-to-day life, correct?
Yes, that is part of it. And thanks for help redirecting me back to your original question of how you can tell the difference. So that is a big aspect of it. It's more than just inattention. But there are so it's kind of also a diagnosis of ruling out other problems. So anxiety can make people have trouble paying attention. Depression can make people have trouble paying attention and focusing. So, someone who starts noticing that at 45 you're having trouble focusing, it would be important to look at, are there other medical issues going on? Low thyroid production can affect how you think and problem solve and things like that. Being under a lot of stress, as I mentioned, can make it hard for you to focus and get things done. So when you're looking at, is this really ADHD that no one has recognized up until this point? You'd look back at your childhood, because it doesn't start in adulthood. It really starts in childhood, but people may go through childhood managing until they get to a point where they've got too many responsibilities to be able to manage. And then they start noticing these problems. But generally, they would have a history of having some degree of either hyperactivity or trouble organizing, focusing, concentrating, even in childhood. But now, as an adult, it may be worse.
And so you talked about some of the dangers with taking medications and that they're not as readily available as they used to be. From a lifestyle perspective, how can somebody begin to reverse some of these symptoms of ADHD?
They're not easily reversible. So I will say with ADHD, it also can be a threshold issue, meaning that you've got symptoms that aren't that bad, but they're manageable up until a point where something makes it not that manageable. So what do I mean by that? So let's say you have trouble, your ADHD or your attention issues mostly manifest with you read slow. Sometimes you don't remember what someone said to you because you weren't paying attention, things like that. But hey, you do fine working as a graphic designer when you've got your assignments, you don't have to talk to people, and you just do your work, put your head down, and you can do it because it interests you and you can stay focused. But your job shifts, and now you've got to do a bunch of meetings, and that doesn't work for you now. You can't pay attention and things like that. So now things start to slip. Well, the example I'm using here is to illustrate that if you recognize your weaknesses, like you can't focus on talking, but you can read, then you want to stay away from jobs, or try to the best that you can control. Stay away from things that stretch your abilities too much, or rely too much on your weaknesses, and focus on things that lean to your strengths. So I want to pursue a job that doesn't require me to have to do tons of reading, because I'm not a good reader, as an example. So I go more toward a job that doesn't have that. So like with the planning, for example, if you've got some assignments, keeping calendars or lists. I mean, not all of these strategies work for everyone, but keeping pieces of paper is probably not a good idea. Do you work better with a planner? But like planning out like your goals, and having smaller steps in between, step one and the ultimate goal, things like that. And how you do that just kind of depends on what works well for you.
You talked about it from a vocational perspective and really making sure that if somebody thinks they have or they've been diagnosed with ADHD, doing their best to make sure that they stick to kind of whatever they're good at when it comes to profession. I know that it can be quite different though if you're like at home and let's just say you're married, you're in a relationship, you have kids, and it's not as easy to say, well, I don't like talking, so I'm just not going to talk to my spouse or I'm not going to talk to my kids. What are some ways that you've seen to be effective, either with some of your clients or just through your own research, for people to work on their ADHD in their home life?
I think the things that have the biggest impact with the relationships are listening and interacting with people, and time management. I think those are kind of the biggies that can be sore points. If you're always late, not following through with things that you said that you were going to follow through with, doing what you need to do to keep up with your time, whether it be having alarms, multiple reminders. And this may sound like, oh, that's just so basic, but you'd be surprised at how many people have trouble keeping up with time and don't even wear a watch or don't do anything to keep up with their time. One exercise that I've used with some patients is going through typical things that they do during the day and seeing how long things take for them. because a common problem is underestimating how long things will actually take. So I've got a party, I'm supposed to show up at 2 o'clock. It takes me 30 minutes to get there, and I start getting ready at 1, not remembering that it actually takes me an hour to do all the things to get ready. The person with ADHD may not appreciate that it actually takes an hour. Even though they've been getting ready for years, they still don't have it down in their head that this actually takes an hour. So knowing how long things take, being able to better plan out your activities, and leaving enough margin and room for wiggle room, I think can go a long way in not creating a lot of friction because you're late or you can't deliver something when you're supposed to. And then on the other aspect of the communication, listen in a way as if you had to transcribe what the person is saying. Don't be thinking about what you want to say next, because then that comes across as, you weren't even listening to me. So I tell you something that happened to me today, and then you ask, so where'd you go? I'm like, I just told you. I know you weren't listening. So trying to rein in the mind wandering and things while people are talking to you, and listen as though you had to like repeat everything that I said to someone else, like listening with a lot of intention.
What's your advice for somebody that, let's just say somebody who's listening to this has ADHD, or their spouse or somebody that they're in a relationship with has ADHD? What's your advice for them to navigate the growth for that, so that the person who has ADHD is able to like effectively communicate with their partner, like, hey, I'm working on this, please be patient with me, I'm doing the best I can. And then also from the other side, that I'm sure it can be frustrating at times if you're in a relationship with somebody that's always late, doesn't know can't plan anything, can't follow through. How can that person also learn to have some compassion for what this person's going through, while supporting them on that journey?
That requires a lot of effort on both sides, just kind of how you laid it out there. I think it starts with the person with ADHD recognizing that the problem, the things that they have difficulty with cause frustration for other people. Now, it probably causes frustration for them too. It's not fun having to always look for something and never finding things and all of that. But still, being willing, you have to start with being willing to make changes or do things to improve these things, so that it's not such a burden on the other person. Because if you don't, like if you just say, well, this is the way I am, and if you love me, you'll deal with it, that's not going to work. Because then the other person doesn't feel like, well, if you loved me, you try and improve this. So then on the other side, for the other person who's not affected with ADHD, it's kind of two approaches. One is if your partner or loved one is working on this, so they've started there, then is trying to extend the patience to understand, to stay top of mind that this is a problem that they have, a neurodevelopmental problem. This is not just being lazy or inconsiderate, and having that takes constant reminding, because if you don't think that way, you don't understand. You can understand how someone can't remember to put the toothpaste back in the drawer, or put the top back on, things like that. But then another angle to this support person is not turning into a parent if it's a partner, or becoming the mommy, if it's a woman and a husband who's assuming the role of a surrogate brain and taking care of everything. And it's hard not to slip into that if you want to just kind of be the one who takes care of everything in the family, because your partner is going to forget. So I know that. So I'll just do it myself. But then, the dynamics can end up being that the non-ADHD partner becomes more like the parent or someone that they shouldn't be, instead of being an equal. We're still peers.